Welcome back. I'm going to kind of talk through the very first section in the clinical guidelines. This is 1-01, which is Universal Patient Care and Evaluation. Essentially, this is a guideline for every single patient encounter that you have. These are things that should go through your mind with every patient. The first thing, starting at the top here, is determining whether there is a patient or it is a no patient situation. The second thing is determining the patient's capacity to make medical decisions, and that's Z-01 and Z-02, as you can see up here. The second thing there is obviously in every patient situation, your safety is the most important thing, followed by the safety of the patient and the safety of any bystanders. So again, cross-referencing Z-07, which is infection prevention and PPE, as well as Z-08, which is scene and transport safety. And these are obviously guidelines we'll talk about in future videos. Moving on, here is with every patient contact, you should do at least an initial assessment and physical exam, and these are come from 1-02, which we'll talk about relatively shortly in regards to adult and patient assessment procedures, as well as obviously vital signs. And we always want blood pressure, pulse rate, respiratory rate, and some sort of evaluation of mental status, which is either going to be your level of consciousness or a calculated GCS. Obviously, depending on the patient presentation, utilizing additional assessment and vital sign tools, including pulse ox, end-tidal CO2. Now, with every patient, you should at least consider the next 5 things here. Airway O2 and maintenance is 8-01. In general, this is going to be relatively obvious, and we'll talk about this when we get to that specific guideline. Spinal mobilization should always be considered. And then 1-03 and 1-04, which are both your IV protocol and then your glucose check and glucose management protocol. Do not necessarily have to be done on every single patient, but it should at least be considered in the back of your mind. And then finally, the continuous or 12-lead ECG guideline, which is 1-05. Kind of once you've gone through these basic elements on every patient encounter, then you're going to go on to the actual clinical guideline, which is pertinent to that patient's condition, which again, you can refer back to the table of contents, and we will eventually get into those individual clinical guidelines. And ultimately, at the bottom, if there's a question on a direction that you should take with a patient on a specific guideline, always contact your online medical control, and that may be contacting myself or another director in the agency. That may be a physician at a designated facility or at the destination facility. But if there's any question, please feel free to contact us. As always, if there's any questions or concerns, please feel free to get a hold of me, and I will do my best to provide you with a reasonable answer. Thank you.